Hello, my name is Alison Cope. I'm one of the consultant virology doctors. So I'm doing this because I'm trying to raise awareness of hepatitis across the world and working with some students from the Beacon House Defence Campus. These students are Ahmed Masood, Hamza Mehmood and Farhad Hamid.
Yeah. What is the situation of hepatitis in your country?
So the situation of hepatitis, chronic hepatitis in the UK, is that we see broadly two groups. We see chronic hepatitis B in patients who've come to the UK from countries where hepatitis B is highly endemic and they've acquired it just by the nature of where they were born and raised.
And what causes the spreading of these diseases?
Well, what causes the spread is that patients who are injection drug users share their equipment. So it might not just be a shared needle for actually injecting opiate drugs. It might be the filters that they use to filter out the rubbish from the pure opiate. It may be the spoons that they dissolve the opiates on, or it may be the acids that they use to dissolve the opiates in. And unfortunately, this drug-using paraphernalia becomes contaminated so that when they sit with their friends, they pass on the infection that way.
And how can the spreading be reduced?
The spreading can be reduced by a few mechanisms. So the first thing is by stopping injection drug use, of course, and having increased access to opiate substitutes like methadone and Subutex. Needle sharing, of course, has got to be avoided, and there's a huge campaign to provide clean needles for exchange. We call it a needle exchange programme. The third way might be to screen prisoners on access to jail, because we know that people who go in and out of jail, perhaps for drug-related offences, can then share equipment within jail and infect other prisoners.
Will it be?
From a hepatitis B point of view, we have to make sure that we screen patients who are in high-risk groups, that we provide vaccination to their contacts, and that we treat patients with highly infectious virus, division that's going on at a very high level, to mean that they're less infectious to others.
What policies has the government implemented to further reduce the spreading of hepatitis?
So just last year, in August 2017, the government launched a childhood vaccination programme for hepatitis B, where all children now get hepatitis B vaccine at birth.